Hello, my name is Mary Ciccarelli with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I'm here to review the special aspects of providing good primary care for your patients with intellectual or developmental disabilities, or IDD. Persons with IDD are estimated to represent 3.5% of the U.S. adult population. As a collective group, they experience significant health disparities, including higher rates of chronic health conditions, shorter life expectancy, higher rates of barriers to accessing needed services, significant mental health comorbidities, and frank denial of care, higher preventable emergency room visits and hospitalizations, lower use of preventive services, and lower ratings of patient-provider communication as compared with the neurotypical population. Many of the chronic health conditions in adults with IDD stem from a deficit of appropriately designed health promotion programs or activities. For example, obesity and obesity-related comorbidities like hypertension, diabetes, and obstructive sleep apnea occur at increased frequency. Often, health self-management skills need to be adapted and learned in patients with IDD. Strong relationships with primary care providers can address health habits. Working on plans to achieve adequate hydration, a diverse diet with portion control, and regular physical activity can all contribute to weight management and curbing chronic disease presentations in our patients with IDD. Patients and caregivers express a need for help figuring out how to apply good health habits to their actual situations. Commonly used patient education handouts are geared to higher literacy levels, often 10th to 12th grade equivalency. Adults with IDD need info about good health habits that is targeted to their level of literacy, which is commonly between 2nd to 4th grade level. They benefit from direct guidance with simple rules. Consider this Rules for Staying Healthy handout, which can be found on our website. Provide explicit instructions for how many portions of different types of food and beverage they should work to consume. Give direction on what types of physical activity they should do and how many minutes each day. Talk about what time they should go to bed and wake up to get optimal sleep. Advise specific hygiene habits like toothbrushing for 2 minutes twice a day and hand washing before meals and after toileting. You can also recommend visual tools like portion control plates, toothbrush timers, and the Rules for Staying Healthy handout. This worksheet is not meant to encourage that caregivers institute strict restrictions of activities, but instead be used as a way to offer options in how to work on stepwise improvements in self-care. Patients and caregivers also express a need for help understanding their health in accessing the necessary services to meet their needs. A good primary care relationship allows a clinician to assess a patient's understanding of his or her conditions and offer education at their health literacy level. The website Easy Health has good resources in easy-read format for adults with IDD. Patients need to understand why medications, tests, and referrals are important. They need a point person to answer questions and concerns. They need explicit direction in how to care for their health by taking medicines correctly, following recommended health habits, and keeping recommended follow-up. Patients also need help understanding how to manage flares of chronic conditions to decrease unnecessary emergency department visits or hospitalizations. Creation of stoplight action plans can be helpful in this education. Regular primary care follow-up to reevaluate and reinforce plans is also essential. Having a point person in your office who can be a dependable contact when patients have questions can also improve management of flares. Many patients with IDD have limited communication skills and lack typical sensory awareness. This combination can lead to poor reporting of symptoms. Having primary care follow-up on a regular basis with a head-to-toe review of systems and an exam that specifically assesses for common comorbidities in IDD can allow teams to detect health conditions that a patient may have not reported. We encourage a special focus on risks for increased mortality in conditions called the Fatal Four in IDD. These are the 4 major health issues commonly linked to preventable death in IDD, and they are choking, seizures, dehydration, and constipation. You can find a comprehensive IDD-specific review of systems on our website. Subsequent actions to further assess or treat any condition found during your assessment can improve health, patient sense of wellness, and life expectancy. It is common for adults with IDD to have a history of suboptimal and negative medical experiences. They may have been inappropriately restrained. They may feel as if they've been ignored or told they were wrong. These experiences lead to distrust or fear in future medical encounters. Having a strong primary care relationship can mend this distrust or fear over time. It requires taking time with the patients, speaking to them directly, obtaining their assent or consent to examine them, and including them in creating their own plans of care. Patients with IDD have a lower utilization of preventive health services. Sometimes this is attributed to patient or caregiver lack of knowledge of their importance. Other times, our systems create barriers to access. Just as you do for your general population, it is recommended that your patients with IDD attend an annual exam that includes a preventive health focus. Recommend, review, and advise immunizations and screening tests as indicated for your patient's age, gender, and risk factors. Many specific diagnoses within the IDD population, such as Down syndrome, spina bifida, and cerebral palsy, also have condition-specific screening guidelines that should be included in the patient's annual exam. We hope that many of our tools on forourhealth.org will help you with informing patients and caregivers using language and resources they understand. We also encourage that longitudinal relationships of trust with a primary care team can help patients and caregivers increase their willingness to get the accommodated services they need and want. Thank you for watching. I hope this video helps you feel more confident in providing good primary care for your patients with IDD. To assist your patients in understanding the importance of seeing their primary care team, please refer them to the partner video at forourhealth.org.